All right. Hello, everyone. Thanks for joining us today. We're scheduled to get started, but we'll wait a couple minutes just to let everybody join, and then we'll start the webinar today. All right, it looks like most of you have joined at this point, so we'll get started. So thanks for joining us tonight to learn more about our post-baccalaureate nursing program that we offer here at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Castle. I work in the admission office here, primarily on our Manchester campus. I do have a few of my colleagues here with me, so I will turn it over to them to introduce themselves to you. Megan, do you want to go first?
Absolutely. Hi, everybody. My name is Megan Kelly. I am the Senior Assistant Director of Admission here on the Transfer Grad team. I do work with all nursing students, meaning transfer and post-baccalaureate here on the Boston campus. I do see two familiar names there already joining us, so I'm super excited you're here today to hear more about the information we can offer, and just as excited to see new names alike. And hopefully you get all the information that you're looking for today. But if not, reach out to us. We're more than happy to help you. So with that being said, I'll hand the mic over, I guess, to Professor Caracino.
Oh, you did good with that.
Yes.
Hi, everyone. I'm Professor Sue Caracino, and I teach on the Worcester campus for the nursing program. I teach in the fundamentals when you first start, and then the next level for med surg and pharmacology. Thank you for coming today. Oh, I'm going to hand it over to Erica Bush.
Thank you, Dr. Caracino. My name is Professor Bush. I have been a faculty member for almost 2 years now. I predominantly teach in the 500 and/or senior level, and we can talk more about how the program looks with coming in and then exiting. We are a 16-month program, and I also teach in our public health and community class as well. So thank you for coming. Happy to answer any questions as we go forward.
I think that leaves me. My name is Brett Simpson. I'm a current student at MCPHS. I'm at the Manchester campus. I'm from Windham, New Hampshire, and my previous bachelor's degree was in biology at UNH. I'm happy to be here. If anybody has any questions specific to a student, I'm your resource, so please feel free to reach out.
Perfect. Thank you. I think we got everyone. So again, we're excited to share more information with you about our post-baccalaureate nursing program. Hopefully you'll learn a lot about our program today. If you have any questions as we're going through our presentation, there is a Q&A box at the corner of your screen. So feel free to leave any questions there, and at the end of the presentation, we'll make sure to address those. And at any time, if you need to leave the webinar, feel free. We do record these, so we can always send it to you afterwards if you need to leave early. All right, so let's get started. I will turn it over to Megan.
Awesome. Thank you so much, Hannah. So first off, congratulations on deciding to pursue a career in healthcare or in nursing. Healthcare is a great field to get into right now. The field is really in high demand. And with that aging population, the demand is really projected to increase over the next several years. As we see here, the U.S. Bureau of Labor Statistics predicts the 12% job growth through 2028. You know, 1/3 of all new jobs created through 2026 will be in the healthcare industry. So it's definitely a great place to be. With that being said, our students here at MCPHS are really finding their job placements not long after graduation. If not, while they're in the program, they're being offered jobs that they're doing. Not only does the field of nursing have a very strong projected job growth, as we can see here, but it also really ranks upon the top 30 healthcare careers, according to US News and World Report as well. We do realize that returning to school for your degree will definitely be an investment of both your time and your money, resources, but based on the current job outlook, and the quality of education we provide, we really do believe that this is going to be a good investment of your time, your resources. And there's so many opportunities to look forward to here. But before we do move on, I would like to turn it over to our nursing faculty member, Professor Dr. Caracino. And maybe you could give us a little bit of insight or a little bit of a little more details on maybe career possibilities for our students that they have here. And maybe feel free to give us a little bit of insight on your journey into the healthcare field.
Oh, of course. My journey in the healthcare field is one of the longest journeys probably anyone's ever had. I went to school I graduated from my LPN school at the age of 30, 9 months pregnant. Then I went back to school when my youngest was in first grade for my RN and my bachelor's. And then in middle school, went for my master's and on to my doctorates. So it's been a long learning process for me, but I have loved every moment of it. Nursing, and along the way with each phase of my life, my path in nursing changed. So I started off in long-term care facility, and then I went to a med surg floor, down to the ER. I've done an urgent care. I've done community nursing. So I've really had there's so many different avenues that you can choose, and you can choose them to adjust to your life as it is and what it needs, which is wonderful about it. And, you know, once you choose one path, doesn't mean that that's the path that you need to stay on. So there's always so many different avenues that you can go to. And it's just rewarding. I really enjoy it. And you don't need to becoming a nurse doesn't automatically mean you need to be in the hospital. There are so many other different worlds out there. There's research, there's, you know, there's so many different things that you can do. There's school nurse, there's public nursing, this, you know, your town has a nurse. So there's so many different areas of it. It's not just being in the hospital. So don't pigeonhole yourself into that.
Awesome. Thank you so much. Yeah, I talk to a lot of students who definitely think that you know, the hospital is their destination. But I do encourage them to, you know, think outside of the box, be open. We have a lot of different clinical opportunities here that aren't just specifically in a big hospital, you know. So thanks for sharing your journey and your path, and also a little bit of insight on career outlook. So Hannah, do you mind going over to the next slide? Am I able to? Okay. Wonderful. Thank you so much. So MCPHS is a healthcare specific university, and we do offer 100 different programs here in different fields. And we have been around for 200 years. So if you haven't heard it before, it's something we're super proud of. We've been selling our celebrating our bicentennial now for what seems like at least a year and a half. So we're really proud of that. We are the oldest school in Boston. With that being said, we started just a pharmacy program here in the Boston area, the Boston location on Longwood Medical area, Longwood Ave. But MCPHS has grown to incorporate over 7,500 diverse students between our 3 campuses and our online branch. And healthcare is our specialty, obviously. And many of our faculty are still working in the healthcare field while teaching. So they're really well versed in the course material, and they're constantly staying up to date on the current healthcare system and the trends and evolution and everything. So with that being said, you're in good hands. But then through school-sponsored events and other social activities, our students also learn a lot about the different healthcare professions, even before entering the field. And then lastly here, we really pride ourselves on maintaining the clinical affiliations with some of the leading medical institutions in the nation, but we will touch upon that in more detail. University-wide, it's something like 17,000 clinical opportunities. It is exponential number, but we have many clinical programs, including nursing here, but we have many opportunities for our students to get that hands-on experience and be the best when they leave here. So here is a look at each of our campus locations. The Boston campus, where I'm located, was actually founded in 1823, which I mentioned we're just 200. This is our largest and oldest campus. We are located near the Longwood Medical area, or just within the Longwood Medical area, which is surrounded by several well-known healthcare facilities. Think Boston Children's Hospital, Joslin Diabetes Center, Dana-Farber Cancer Institute, and many more. But a majority of the programs we do offer at this campus are undergraduate. But we also do offer a variety of graduate and doctoral and certificate programs here too. And then there is university-sponsored housing for students who want to live on campus. We do offer it here in Boston. Then there's our Worcester campus, which is located about 40 miles west of Boston. And we have our, our location there. Worcester is home to our second largest campus, which was founded in 2000. It is the second largest city in New England too, fun fact, just after Boston. And it is one of the fastest growing hubs of innovation in the US, which is pretty cool. So again, you're learning in a really highly evolving area. And I believe it was NPR, they recently deemed Worcester as the new IT town. So lots of growth and opportunity there. And there you'll find healthcare right at your fingertips. So for example, there is St. Vincent's Hospital just steps away from the campus. The big hospital out there, if you will, respectively, would be UMass Memorial Medical Center. It's one of the we're part of one of the largest Massachusetts, largest integrative healthcare systems. And there's many other healthcare opportunities within a 10-mile radius to the Worcester campus. All of the programs that are offered on that campus are either graduate, doctoral, or post-baccalaureate. And if you did want to live on campus, there is university-sponsored housing available in Worcester as well. And then there's our Manchester campus, which we founded in 2002. And that campus is located right in downtown Manchester, New Hampshire. And this is our smallest campus. It's only about an hour north of Boston and Worcester. And it's within driving distance to several healthcare facilities in the state of New Hampshire, including Elliott Hospital. Concord Hospital is quite popular with our students, I've heard. Dartmouth Hitchcock Medical Center, and many more. That campus hosts the postbaccalaureate program, graduate and doctoral programs as well. One thing to keep in mind though, we have off-campus housing, so it's a little bit different, but we do have off-campus housing available there. So I'll turn it over to Hannah to chat a little bit more about MCPHS, and we want you to be successful here. So I'll have Hannah highlight that.
Perfect. Thanks, Megan. Yeah, so our university here at MCBHS has a reputation that's dedicated to the success of our students with an immersive hands-on culture, starting with what we call interprofessional education, also known as IPE. At least once a semester, students participate in IPE activities where they engage with students in other programs. For example, our nursing students might work with pharmacy students, or they might work with PT students. It's really a great way for students to learn about other healthcare professions, how to work with patients from other cultures and backgrounds, and the functions of a team, and how to work as a team once employed in the healthcare system. So I know, Brett, you've been involved in a couple IPE events. Would you be able to share your experience with those and how you were able to connect with students from the other programs?
Yeah, totally. So, I mean, the IP events are great because me being a nursing student, I mean, there's so many different industry or professional roles that you can play within the healthcare industry. And so this is kind of an event so that we get all together and kind of figure out what each role does. Personally, I participated in, we call it like a book club. We all read a book. This past one, it was a book kind of based on individuals from another country, and we learned about how culture and everything can dictate and be different in terms of the way you care for each patient. And so what we did was, as nurses, we kind of helped and brought in the education aspect. As PAs and pharmacy, they all brought in what they do best. Same with OT. We learned kind of how each interprofessional role can kind of work into having the best kind of patient outcome. So I guess that was the entire goal, really, is how can our patients succeed? And so we all learned kind of how we can work with each other to make our patients successful, make them healthy, and have them go home. So I think it was a great experience. There's a couple other events that have taken place. One recently was kind of just getting to know the role of what each healthcare professional does. So PAs, what they do, pharmacy, what they do, OT. And so I think it's great. We all get together and kind of, it almost kind of decreases the nerves you have. When you jump into the professional field, it can be kind of daunting. When you already have a little bit of experience with other professions, you are a little bit less nervous. You have a little bit more of an idea of what might take place. So I think it's great.
Perfect. Thank you. Professor Caracino and Professor Bush, is there anything that you would like to add to that?
We do for, so each campus is because of where they're located and whatnot. So Manchester and Worcester, we get together and do IPE events together. So that we'll have the Manchester campus meet the other didactics like Brett did, and they talked about a book. There's also in Worcester, we have Worcester and Manchester. If you come in the fall, if you start in the fall, we do actually, it's a roles and revert roles IPE, and then we have in the summertime, we have a Narcan event, and every event is to not just learn about the topics, but to learn about each other so that we are familiar in our roles and what other healthcare roles there are that we have so that we can treat the patient as a whole. And so, you know, it's really important to be able to know about all the other support services and the, you know, what does OT do? What does PT do? What does acupuncture, the pharmacist, the, you know, the hygienist, all these things, there's every role is important to the health and success of the patient. So the, you know, the people that we care for. So it's really important. In Boston, they have an event that they actually have actors come in, and you all go in as a group and you talk to the actor and you have to figure out what are their meds and what's going on. And we all learn to work together as a group to care for this patient as a whole. So it really is a great opportunity because it prepares us for what life is going to be when we are taking care of patients.
To add to that from Dr. Caracino, there are other opportunities for the student to get involved further within the profession of nursing. Not every campus, but some campuses have NSNA, which is a Nursing Student Association, and there's also Nursing Students Without Borders, which we support here in Worcester and other campuses as well. Also, a fun thing that we did for our senior students this year is we have simulation, and I think we'll maybe discuss that a little more later, but in our lab, we'll have simulation where the students interactively treat a patient. And in one of our sims, you are to call the provider for orders, and you're actually speaking to our PA, our physician's assistants faculty, and has a chance to interact and communicate in a safe way, a supportive way, to really what it's like to be giving report to a provider. So a lot of different fun things that we offer here. The things to highlight with peer mentors and peer tutoring, we definitely have that, and we encourage interaction for our students. I think sometimes when we're adults, because all of our students in the nursing program, most of them they all have bachelors in something else. So at least here on Worcester campus, and we want to encourage interaction and camaraderie between the cohorts.
Perfect. Thanks for sharing. Yeah, you are right that there are like definitely other ways to get involved on campus through, programmatic clubs, or we have others that are not program specific at all, like outing clubs, student government association and whatnot. So there's other ways that you'll get an opportunity to connect with students from other programs as well. Brett, I know you're pretty involved on campus. Do you want to share the different things that you've been able to become a part of, and kind of how you go about balancing, school and also doing those extracurricular activities?
Yeah, definitely. So on campus, I'm involved in student government. I also am involved in peer mentoring and peer tutoring. Student government is a blast. We put on events for the entire student body to kind of get everybody together, have some fun, and then focus a little bit on healthcare. But I think that overall, getting everyone together, having you kind of more acclimated to MCPHS, that's kind of our goal. And that kind of transitions my role into the peer mentorship. It starts on orientation. Actually, it really starts before orientation. They have us, the peer mentors, reach out to students and kind of get to know everyone, kind of bring everyone together who's going to be in your cohort. And we help kind of guide that role. You are in an undergraduate program or may have been outside of school for a little bit, and we kind of help reacclimate you to MCPHS and to kind of what to expect. As far as peer tutoring, I help with the didactic portions of class. So you name it, we go over it. If there's something that's covered in class or mentioned in class, we can go over it. And it's all geared towards what the student needs and what they want to kind of take out of it. As far as managing kind of like that balance between work, life, and school activities, I think that without a doubt, it's important. This is a graduate program or post-baccalaureate program. Without a doubt, it's important to have a school first mindset, but I think it's completely doable. I think every professor would want you to have a life outside of school. I think it's important to your success in the classroom. Me personally, I do many things for fun, go to the gym, all those things. And that never stopped. I also work as an LNA. I work 16 to 32 hours a week, just depending on how school's going. But having that school first mindset, that's the most important thing. If school or didactic is not going so well, you might need to pull back on certain things. But overall, I'd say it's person specific, but completely doable.
Perfect. Thanks for sharing. But yeah, we are, we're here for you through your journey. And we also have supportive faculty, which are right down the hallway as well, that are there for you. So if you ever need anything, you always have somebody that you can go to. In addition, we also have resources through our Center for Academic Success and Enrichment Department, also known as CASE, to help students who might be struggling academically. And as Brett mentioned, we have peer tutors and mentors that are available for students. So just know that you do have those resources available to you as a student. We also have on-site counselors for mental health emergencies and wellness, as well as the Center for Career Services, where they can assist you with resume writing, mock interviews, and the job search for when that time comes. So we're definitely here to make sure that you are doing well in your program. But again, it's also important to take time for yourself too outside of the program. All right, so moving on, we'll highlight just a couple of things about our nursing or our School of Nursing, the programs that we offer. I know we're talking about our Postbaccalaureate BSN program, but we also offer a couple different programs that I'll mention as well, in case you're looking to continue on after your postbac nursing program. So starting with the postbac nursing, so it's a 16-month program designed for students who already hold a bachelor's degree in something other than nursing. Honestly, we've had students come in with multiple backgrounds. We've seen, health science degrees, we've seen history degrees, you name it, biology degrees. So it doesn't have to be in nursing, it could be anything else. Because what you'll learn in the program is everything that you need in order to become a registered nurse. So all the courses are nursing specific. Again, it's 16 months, it's year round, so it's 4 total semesters, and it's available across all 3 of our campuses, Boston, Worcester, and Manchester. And there's 2 different start dates in which we can accept students, either fall or spring. We also have a traditional 32-month program on our Boston campus, which is accelerated in nature, being that it's only 32 months long. People often confuse this program with our Postbaccalaureate BSN, but it's important to note that the accelerated BSN is more like the traditional program. So you'd see a lot of like freshmen or first or transfer students going into that program. So if you already hold a bachelor's, the Postbaccalaureate BSN is the one that you would want. And lastly, we also offer graduate nursing programs, and those are all offered in a convenient online format. We have a family nurse practitioner program, psychiatric mental health nurse practitioner program. Both of those are available in our master's in nursing, as well as a graduate certificate program. And then we also have a Doctor of Nursing practice program. So plenty of opportunities to continue on with your nursing career here at MCPHS. And during the postbaccalaureate nursing program, our nursing students do have access to a wide array of resources to aid in their learning process and prepare them for a future career as a nurse. So like I said, all the courses that you're going to be taking are nursing specific, but throughout the program, our students also have access to the use of educational technology, multiple clinical opportunities in a variety of different settings, NCLEX preparation, which is the board exam that you'll take after graduation, and the use of state-of-the-art labs and facilities for your labs, as well as your clinical experiences. So with that being said, I'd like to turn it over to our faculty to share a little bit more about our nursing program with you. Maybe share, what the simulation lab is all about, what experiences our nursing students get exposure to, different things like that.
So I'll start. For our BSN program, like Hannah said, that it's 16 months. It is year round. We have a fall and spring start for our semesters. They are 16 weeks long, I believe, 16 weeks. Our students go through multiple experiences, which is great for their learning process. So I think active learning is always the best. And I think that they love their lab and simulation experience. So they are in the classroom, especially to start. There are also asynchronous opportunities or online classes as well that the students will go through as they progress through the curriculum. So they'll start in the classroom, maybe have one online class, and they will also have lab and clinical. Clinical is super important. We need 450 hours total throughout the program. Those hours are divvied up through clinical courses. One of the main courses I teach is Advanced Med Surg for our seniors, and they need 135 clinical hours for just for that class. So it's a good chunk out of that 450 they need. They go to clinical, they go to classroom, they have an online capstone program class, which they do love, and I love going to capstone day. It's such a fun day, and simulation as well throughout the curriculum.
Also throughout the program, so with the sim lab, they are automated, so we're able to have the mannequins talk, they have breath sounds and vowel sounds and heart sounds, and so it's a safe environment for the student to practice in, so that they feel comfortable going out into the real world. And it builds, so it's a scaffolding. So when you first start your first semester, you will take your fundamentals class, and you will also take a health assessment class, both which have labs, but you will also go to clinical right off the bat.
Mhm.
So you go to clinical only for 45 hours in the first semester, but we're usually in a long-term care facility because we want you to learn the fundamentals, learn to be able to have good assessment skills of your patients, so that when we do take you into the hospital environment for the 300 level, you already have that down pat. So now you're just getting into the nursing diagnoses and the medical diagnoses and giving out medications. So we build upon everything. So you will have a variety, and you will go to maternity and pediatrics and psych, and then off to Professor Bush with critical care. So it really is great. We have, throughout our program, we have designed our program around preparation for the boards. So that's the biggest factor of this, right? You can go to school, but you need to pass the boards and you need to be licensed. And we pride ourselves on that. And we pride ourselves on our pass rates that have been really wonderful. Now that COVID's over. COVID kind of gave us a little kick in the pants, as everybody did. But we have really, all of our students that are graduating have been doing wonderful on the boards. And we start right off for our exams. We mimic our questions to reflect what you would have in the boards, so that you're ready. And we have we give questions each week. We do interactive teaching, and so that you're ready. When you graduate, you're ready. And I just had a student before they came in. She graduates in May. She's already got a job at Duke in North Carolina on a neuro step down unit. So I mean, and she's just thrilled. And so there's so many different opportunities for you.
Perfect, thank you. And Brett, I know you're about to graduate too, and you have, correct me if I'm wrong, but you do have a job lined up as well, is that right?
Yep. I actually accepted the position, so I have a job now, which is extremely exciting. And to be honest, if you told me 16 months ago that I would be ready for a job in nursing, I was gonna freak out. But like the professors have said, like lab and class has kind of geared you to get ready to take the boards, but also geared you to take on the medical field as a nurse. In terms of lab, I view it as like a test run for real life situations. You have the ability to make mistakes, but honestly, 9 times out of 10, the patients that we see in lab or the sims that we go through, you're going to see in clinical. I feel like all of them, it's like deja vu because you've already done this before, and then you see it in clinical and you're like, oh, okay, I know what to do. And it helps kind of put the plan in action. And having that practice gives you much more confidence, kind of going into it. I'm maybe I guess one of my favorite labs because I noticed earlier somebody said that healthcare is not just within the hospital. And I think that was one of the biggest things that I took out of my 16 months here is that originally I really want to work in a hospital and everything, but we had one lab experience, which was a home care setting. And that kind of threw the trajectory for everyone. Everyone was like, what is going on here? Um, and it was so insightful to kind of see how the majority of healthcare is really outside and it's at the patient's home. And it's those VNA nurses and kind of staff who help kind of keep the patients out of the hospital. We see a lot of the patients come in and they're kind of at their worst, but not everybody's always at their worst and they get to kind of when we had that home care thing, it was like a realization of, hey, there's so much more to do in nursing. It was kind of, yeah, it's not like Dr. Caracino said, don't pigeonhole yourself. And I think that was one of the biggest things for me. I came into school, I wanted an ICU job. Now I could not even tell you, no way, no thanks, it's not for me. But I would have never known that. If I kind of was stubborn and stuck to it, I probably would have saw myself applying to jobs like that. But kind of broadening the horizon, I think lab and sim helps kind of give you an idea of what maybe you're going to expect. And then also clinical, you see so many different things. If you want me to go into what I have seen in clinical, I can. Clinical, I mean, you name it. I've seen postpartum hemorrhage. I've done postmortem care. I've dropped an NG tube. I have given all types of meds. I have held a human lung. It has been nothing short of amazing. So I guess the possibilities are endless.
That's amazing. I can't believe you've held a lung. That's awesome. Very cool stuff. That's actually a good segue into our next slide, which is about our clinical experiences. So here's just a quick look at the different clinical rotations that you'll do during the program. So you'll have a med-surg one, mental health, maternity, pediatrics, community health, and then you'll have your final advanced med-surg rotation. And so again, you'll do these alongside doing your classes and labs. And like we previously mentioned, you'll start your clinicals right off the bat in the first semester. Usually about halfway through the first semester is when you begin those clinicals. So I'll turn it back over to our faculty, our current student, to share a little bit more about the clinical opportunities that you gain exposure to, where students usually complete their clinicals, how they're supervised, how they're assigned, because I think a lot of times students come in, worried that they're going to have to find their own clinical placements. So maybe talk through that process and what it looks like. So I'll turn it over to our faculty first, if you wouldn't mind sharing.
All right, I'll start, like I said, I'll start from the beginning and then I'm gonna put it to Professor Bush because she can describe where I take care of the first part, she takes care of the end part, so I think it's a great segue. So yes, you do start week 4, right after you've learned how to take a blood pressure and temperature and pulse. So what will happen is 4 weeks you'll be going to clinical. And sometimes it could be on a weekend, sometimes it's during the week. It all depends on what we have for availability. And it's 1 day a week and it'll be for 4 weeks. And that's where you'll be in a long-term care facility so that you get to learn how to talk to a patient, how to assess, how to get all your skills down so that when you do get to the 300 level, it will be, you'll be ready to hit the floor and learn about the medical conditions that you'll be going into for med-surg. So then that second semester, you'll be going in to hospital environments. Every one of them, everybody's gonna be in a hospital environment, either on a medical surgical floor or cardiac. We prefer medical surgical because that's what we're teaching you. Cardiac is more with Professor Bush towards the end, where you'll be learning to do rhythms. In between us, you will be going to maternity and pediatrics and psych, and you will do a clinical in each one of them. And you may not do a full semester in each one because you're taking all of them at the same time, but you'll do a few days in maternity, some days in pedi, some days in psych. So it kind of mixes up the world a little bit for you, so which is nice. And then when you're ready for your final semester, you come to Professor Bush.
So there's a lot of clinical in senior level. I would have to look at the curriculum plan for how many clinical hours you do per, like how many you do in 200, 300, and then so forth. So 500 is a little bit different as you're a senior now, and as our student said, if you had asked him 16 months ago if he felt prepared, he would have laughed, and now he is feeling prepared, which I'm so happy for you. Thank you, Dr. Caracino, for putting that into the chat for hours. So in 500 for advanced med search is a little bit different about clinical placements. We start week 3 or sooner. There's opportunities for preceptorship in 500. So that means you will have a one-on-one with a preceptor in a hospital. Now, our preceptorships are unique where students who really thrive on that one-to-one learning atmosphere thrive in that situation. Others really do well in a traditional group. So we have both. We have groups, traditional group clinicals, and preceptorships. We also have an emergency room rotation, which is almost like a hybrid. It's almost like a preceptor / clinical group model. It's a little bit different, and it's really awesome. Obviously, there are limited spaces. You apply for if you'd like a preceptorship or if you'd like to try to go for the ER rotation. And there's a whole process that we will help you with getting those clinical experiences. For policy, we have a clinical coordinator for each campus who assists with assigning you your rotation. Like I said, for 500, you have the ability to apply for different experiences. Slots are limited, and not everybody obviously can get preceptorship or the ER, but a few of you can for sure. You will not have to find your own clinical site. We will always provide that for you. I believe the rule is within an hour of where you live. And you do need to apply your own transportation. So that sometimes is a little bit of a challenge, but I know that we can help our student affairs office, and we can get you in contact with your peer group for carpooling and different things to get you there. So one thing I would recommend for all of you who are listening, that this is an aggressive 16-month program. It is definitely busy, and you won't always know what your schedule is going to be, and it may change from semester to semester. So just keep that in mind. I heard that our student works. I know his schedule needs to change often because of when is lab and when is clinical and when is class, and that's going to change per semester. But I think overall clinical is where all of that magic learning happens, and I really feel that we do clinical very well here.
I think that summed it up very well. The magic is kind of where it happens, but it's also your opportunity and your chance to kind of jump in and see the unknown. So I think that the clinical faculty is wonderful at helping getting you these experiences, but I think it's also on you to seek out cool opportunities and seek out different things that you have not seen before. I would have never gotten into that lung surgery if I didn't run into the PA and say, "Hey, what do you do for work?" And it just started a conversation. And he was like, "Hey, I have a 6-hour lung surgery. You want to come?" And I was like, Yep. So I think that overall the clinical faculty is like your best friend, and they're going to help get you the opportunities that you want to see. But I think it's also behooves you to stay interested and ask questions. If you don't know something, like just the amount of nurses who want to be there and teach you, it's unbelievable. I feel like everyone there, they love having students. It's not a situation where you walk into and they feel or you feel a little uneasy because you are a student. Everybody wants to include you, wants to involve you, and it's a whole kind of learning experience. As far as clinical rotations, I've had a few rotations, not a few, I've had many rotations. I had a couple at Elliott where I saw the NICU. I also did their labor and delivery unit, which is where I saw the postpartum hemorrhage, but I also saw a couple C-sections. Um, I went to Southern New Hampshire, which is in Nashua, for their pediatric unit. We got a cool case of cellulitis, which is like a skin infection that went kind of wrong. And overall, I have some of my peers have gone up to Dartmouth Hitchcock. They have gone really all over the place. So I will say for those who may live in New Hampshire, please do not rule out the Manchester campus. The Manchester campus is wonderful. And the amount of opportunities that we get are like amazing. So the faculty, I'm sure is, I'm a little biased, but the faculty is great in Manchester. And so please, yeah, please do not rule us out. Other than that, like you said, balancing kind of that work-life thing. I was fortunate enough to get a preceptorship, but that means that I follow the schedule of my preceptor. So she works on weekends, and for me, as somebody who works per diem, weekends were my prime time. And so I kind of had to adjust. I went from the 32 hours to 16, and I'm lucky if I do 12 now, but that's okay because it's all like looking towards that goal of becoming a nurse, starting my professional career. So I think people need to kind of have that outlook of, hey, this is where you want to end up, and this is the environment that's going to help you get there. But overall, I can't say enough good things.
Wonderful. I love all the information. It's making me want to become a nurse. If only I didn't
Also,
like.
I
Oh, yes, go ahead.
wanted to interfere. I apologize. I wanted to interject. Everybody wants to go to Boston. All right. Everybody wants to go to Boston. They want to go to Mass General and they want to go to the Brigham. Well, you're going to learn anywhere you go. So don't pigeonhole yourself for the campus. Do what works for you, what works best for you as well, because every campus has wonderful opportunities. They each have their unique personalities and they have great opportunities, whether you're in Manchester, like look, Brett was talking about all these great experiences he had. Boston is great too. But honestly, as I was walking in today, there was a helicopter over my head landing on St. Vincent's with for a med flight. So I mean, there, no matter where you go, be it in inner city or community, you're going to learn and you're going to get these experiences. So just as much in nursing for yourself as a student, broaden your horizons.
Love it. Thank you. All right. So let me see. I'm trying to get the presentation to move. All right. So we will talk a little bit further about application stuff. Hopefully you've learned a lot about our program. I definitely have as we've gone along. Like I said, I would go into nursing if I wasn't scared of blood. So good for you for wanting to go into nursing. It's definitely a great career field. So hopefully after today you'll want to apply, or if you've already applied and been accepted, congrats on your acceptance. We hope that you'll consider joining our program. So I'm actually going to turn it over to my colleague Megan. I'm hoping maybe you can walk them through the application process.
Absolutely. Thank you so much. And Professor Caracino, just to further emphasize that when it comes to making the decision on which campus to go, You're absolutely right. All campuses are fantastic and it is purely geographical. So whichever one's closest to you, you're going to have the same awesome, excellent experience. You have the same opportunities as any other student. You'll have the same classes. The programs are essentially aligned. So pick the location that may be closest to your home. So that way there, if you're in Western Mass, you're not driving all the way to Boston. Go to our Worcester campus, or if you're a little bit more North Shore of Massachusetts, go to the Manchester campus if you don't want to drive all the way into the city. So all campuses are aligned, but either way, start your application. Hopefully, after hearing from everyone today, you're thinking about that. And here, I will walk you through that. As we previously did mention, we do offer 2 different start dates per year for the post-bac nursing program. The fall semester, which begins in September, and then the spring semester, which begins in January. I know it still seems like winter in January, but that's technically a spring semester. We are currently accepting applications for the fall 2024 semester, and we do welcome you to apply sooner rather than later, as applications are accepted on that rolling admissions basis. So it's really best to submit your app as early as possible for priority consideration. So you want to get that started. To apply, you do have to complete the nursing CAS application. You'll go in, start your application, submit all the documents to nursing CAS. Do not send us your transcript if you apply to nursing CAS, because we can't do anything with them, unfortunately. Everything has to be done through the nursing CAS. What we require are all your official transcripts from all colleges and universities you've attended. Let's say you were in the Army and you have a Joint Forces transcript because you took some intel communication courses with the Navy. Great. Submit that Joint Forces transcript to us. You took jujitsu with the Army. Fantastic. Submit that transcript to us. So even if you don't think it's going to qualify, nonetheless, we still need that. If you have any international coursework done, let's say you went and took some classes at anatomy physiology at a school in Canada, you will have to have that transcript evaluated for that credit. So make sure that if it is international coursework, you have that transcript evaluated. And if it's not in English, make sure it's translated too. And then finally, we require a personal statement. We recommend between 500 and 1,000 words, just describing your goals, reasons for pursuing nursing, your interest in MCPHS, would be fantastic. Students who do apply to the Manchester campus may have to submit a high school transcript as well to be accepted into the program, but you may be able to wait for that. But I always recommend best policy is just request that transcript to get it ready to be sent over. We do not require a GRE, which is a graduate school exam, or a TEAS for this program. While you're in the program, there may be some tests you have to take for classes, naturally, but to get in, you have to take a GRE 1 because the GRE is for graduate school, and this is a second bachelor's degree. And then the TEAS, again, isn't required for this program. It's just simply not required. So those are basically what the application requirements are. We try to keep it as concise as possible. We don't need letters of recommendation. In the past, it's really held up applications. So just your official transcripts, all of them, and your personal statement is perfect. Awesome. So in addition to having that bachelor's degree, there are some core classes that you do have to take in order to be successful in this program. Like Hannah said, no matter what your degree discipline is in your first bachelor's degree, that's fine. As long as you have these prerequisites, this is what's going to make you most successful. So you can or the prereqs are, I should say, anatomy, physiology 1 with lab, anatomy, physiology 2 with lab, microbiology with lab, Gen Chem 1 with lab, Gen Chem 2 with lab, or nutrition, human growth and development. We are really looking for a birth to death timeline. Just a child development class will not satisfy this. We want the entire lifespan, because you will be learning the entire lifespan from birth until death in this program. So it's really important to have that class. And then there's statistics. You can apply with a couple of these prereqs in progress. You can apply with them all done. You can apply with 1 course in progress. That's totally fine, as long as there's enough time for you to complete all those by the time you're sitting in seat. So we do need those courses to be completed with a grade C+ or higher from a regionally accredited college or university. If you're like, what's a regionally accredited college and university? I have no idea. That is okay. Run it by me and Hannah. We're more than happy to double check for you. My best policy, I always tell students, if the website seems kind of cheap and hokey, it probably is. So, you know, run it by us if you're concerned at all about it before spending your time and money. And we're happy to give it a absolutely, totally fine, go for it, or absolutely not, do not register for that, look for something else. Here's some recommendations. We're happy to do that too. But you want to make sure you have a grade of C+ or higher in all of those prereqs. We also do accept CLEP scores of 50 or higher, AP scores of 4 or 5. But do keep in mind there is a 10-year time limit on math and science courses. Now for CLEP, I don't necessarily recommend taking a CLEP for any of the lab sciences if you have never taken them. Someone like, you know, Professor Caracino or Professor Bush may be able to CLEP out of a chemistry class because they've been teaching a certain discipline for so long. But if you've never taken chemistry, I do not recommend CLEPing out of it. Because if you do not pass it, you will need to take the class and it could run into issues. So with that being said, I don't recommend it. But we would take it if you have taken it. Again, 10-year expiration limit on math and science courses. We'll review your courses, determine which prereqs that we can accept, which ones you might be missing during the app process. So do know that when you receive a decision, you'll know exactly if you need to take anything, if you need to take anything over, if everything's satisfied. You'll see that right away when you receive your decision. If you're missing any and interested in taking them with MCPHS, so let's say you haven't taken human development, very commonly our students haven't. We may be able to make a recommendation on where you can take that. We do offer courses through our School of Professional Studies, online, self-paced prereq courses, and they are at a 50% reduction to the cost of a prereq through our School of Professional Studies. So if you want a 50% discount, let us know. We will steer you in the direction of our website where you can complete a discount form and register for the class. Super easy. And then they give you the amount of time to, as a regular semester, which is 16 weeks to complete it. But if you get it done sooner because that's all you're doing, fantastic. But, you know, 16 weeks is typically the length of time you have to complete that self-paced course. So again, let us know if you have any questions or concerns about prereqs, and Hannah and I answer these all day, so we're more than happy to help you out.
Perfect. Thanks, Megan. And just to touch on housing again, I know we briefly mentioned that we do have on-campus housing at our Boston and Worcester campuses. If you're interested in those campuses and you want to live on campus, you can certainly feel free to explore housing there. The housing is competitively priced compared to housing in the area, and rates are also located on our website, so feel free to check those out. Prices do include utilities, and our units also come fully furnished, so that's something to take in mind. But there's different types of housing that you can choose from suite style to condos to studios. So definitely check it out and see what works best for you. And they also are within close proximity to different facilities on campus, like fitness centers, cafes, computer labs, game rooms, study spaces. So those are all within a close proximity. And again, we don't unfortunately have housing on our Manchester campus, but There is plenty of housing around the Manchester area. If you are ever, looking for housing and you need recommendations, we do have a great off-campus housing page on our website, where we've put some recommendations on there. I personally have lived in Manchester and the surrounding towns, so if you're interested in Manchester, don't hesitate to reach out to me and I'm happy to point you in the right direction. Great. And finally, we have a slide about financial aid. So this program is eligible for financial aid through the FAFSA. So feel free to go ahead and fill that out. Our school code is 002165. And you'd actually want to fill out the undergraduate FAFSA since this is considered a second bachelor's degree. So feel free to go ahead and fill that out. I know there has been a couple changes with the FAFSA this year, and there's been a couple delays in schools receiving FAFSAs, but once you fill your FAFSA out and if you've been accepted to our program, we'll make sure to provide you with a financial aid award letter as soon as possible once we get it. We'll also consider you for merit scholarships when you apply to the program. So we will definitely review your application for those. There's no separate application that you need to fill out to be considered for a scholarship. We'll just use your nursing CAS, and if you're eligible, we'll make sure to notify you of what scholarship you received at the time of acceptance. And if you have any questions in terms of financial aid or funding the program, we do have a student financial services department that's more than happy to connect with you. You can schedule an appointment with them, you can call them, email them, and you can find their information on their website as well. All right, so that does it for today's presentation. We hope that you learned a lot about our program. And again, if you haven't yet applied, we are still accepting applications for our fall 2024 start date. So feel free to go ahead and apply, and we're more than happy to consider you. I also put our contact information down. So my colleague Christian, he works at our Worcester campus. So if you're interested in applying to Worcester, feel free to take his contact down. You'd primarily be working with him through the application process. If you're interested in Manchester, feel free to take my contact information down. And then if you're interested in Boston, Megan is your go-to, so feel free to take hers down. We also have some great YouTube videos. We have an Instagram page. We also offer campus tours and have a couple upcoming events coming up. We actually have an open house at our Worcester and Manchester campuses in April. So feel free to visit our visit page. It's www.mcphs.edu/visit to register for one of those upcoming events, and we hope to see you there. All right, well, I guess looks like we might have a couple questions in our Q&A. Megan, do you want to pop those up and see what questions we have in there? I think we have some. I could be mistaken.
We don't have any, but I did want to encourage students to, if you have any, do not be shy. But yeah, just to kind of reiterate with Hannah, I definitely recommend coming to campus, come visit us. And if you're on the fence between a couple, take the drive, see which one is closer to home, and which one that might help you kind of decide which one you're most interested in attending. Because like everyone mentioned, Brett, Professor Caracino, and Professor Bush, every campus has a little bit of a different feel, but it's really important to come and visit us and meet with Hannah or myself and get an overall feel. It's super important to do that. So we have plenty of events that go on, so I hope to see you on campus. Did anybody else have anything else to add? We'll wait a couple more minutes for questions to come in. Nothing's come in yet, but did anybody, Professor Caracino, Professor Bush, Brad, did you guys have anything else you wanted to add that we may not have touched upon that students may be interested to hear?
If anybody wants to reach out to me, Hannah, you can give my email to them. I'm more than happy to help.
Perfect. Thanks, Brett.
I guess one of the biggest things I would like to tell everybody is you're not here for us. We're here for you. So when you come to this campus, it's not a place to be afraid. It's a place to be excited and to learn. So, and one of the biggest things I hear from our students a lot of times is you're not like in my other college, because they're you hear about nursing instructors are mean and da, 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 da. No, we're here to grow you. We're here to make you the best nurse that you can be. And it's a safe environment that we have that in. But I'm sure you see that you have your instructors in the lab, and then you see them on the floors to come in a visit. And if someone's struggling, we have all the resources. We can peer tutoring, we have RN tutors, we're approachable, we're here for you. It's not a dictating thing. It's a growing together.
Yes, thank you so much for sharing that. We are a small school, so I think that is one of the benefits. I went to a UMass system, not knocking it at all, but I was in a big lecture hall. You know, we had a sign in on a sheet and the professor had no idea who I was. But one of the benefits of being in such a small private university like we are is, you do have that hands-on faculty and your interest in the students and making sure they're successful. So that's one big benefit, I think, of coming to a small school like us. All right, well, I won't hold everybody. It looks like, if we've given the opportunity for questions and nothing's come in, which means we must have did an awesome job, or a wicked awesome job, as we would say here in Boston. So thank you everybody so much for sharing your hour with us and your evening with us and hearing about our program. And Professor Caracino, Professor Bush, Brett, thank you so much for sharing all this wonderful knowledge. Like Hannah said, I wish I was inclined, and I'm a little scared of blood in my aging here, but I wish I could go into that profession. So thank you for all you do and all of your hard work and the field and everything. And thank you for being here today and sharing this time with us. I hope everybody has a wonderful evening.
Take care,
Thank you.
everyone.
Thank you.
Bye.
Brett, good luck.
Good luck, Brett.
Bye.